All right, go ahead. All right, do we want to get started then?
Yeah.
Hello, everyone. Welcome to our last webinar of 2024. We have Dr. Stephen Kalff and Dr. Marianne Birch of the BirchBark Foundation. The BirchBark Foundation is a 501c3 nonprofit that was started in 2013. We offer pet aid and emergency vet care to financially vulnerable animal owners in Monterey, Santa Cruz, and San Bernardino counties. And we really are set up with three distinct areas, and pet aid being our primary area of concern, but the other two are very much in our thoughts as well, especially around the holidays. We offer grief support to anyone. You don't have to qualify for financial assistance, but if you are having issues or some have experienced loss recently or are considering that direction, our grief support and counselors are standing by for anyone. Tonight, we're going to experience the webinar in our Learning and Education series. And we have hosted several of these in the past. You can find those on our YouTube channel, on our social network channels, and on birchbarkfoundation.org. Here are a few of the cuties that we've helped and the families that we've helped over the last several months. And with that, I'll pass it off to Dr. Stephen Kalff. And if you stay tuned after the talk, we'll have a Q&A with Dr. Birch and Dr. Kalff. Marianne, would you like to say anything?
Yes, I'd like to introduce Dr. Kalff. So Dr. Stephen Kalff graduated from the University of Melbourne in Australia with his veterinary degree. And after a little bit of time, decided to relocate to the UK to complete a residency in veterinary surgical training. And he stayed there as a senior orthopedic and spinal surgeon at Fitzpatrick Referrals after he reached his diplomat status. And he's been working at Pacific Santa Cruz since April of 2018. And he's published extensively on a variety of subjects with a primary interests of joint replacement, trauma, and canine elbow disease. And I can say when we worked together, I loved having his input on my patients for lameness and orthopedic disease. So welcome, Dr. Kalff.
Good evening, everyone. Bear with me a moment. I'm just going to pull up my slides. And so tonight first of all, thank you for the introduction. Tonight, and thank you all for coming to spend the evening with us. We'll be talking or doing a little bit of an introduction on veterinary orthopedics, and it's a pretty broad subject. And I'll often get asked how I remember all the different anatomies of different animals. And to be fair, it's a bit of a cheat code in that it's a big epiphany that we're all built off the same models. So dogs and cats are very much built off the same model as you and I. Their front legs are like our arms, their back legs are like our legs. They've got the same organs, the same body systems. And so realistically, whilst there's lots of different models, we're all built off the same, we're all very much the same. And as such, we get the same sorts of injuries, the same diseases, and more often than not, we can be treated in very much the same way. In fact, over the last 10 to 15 years, there's been this drive towards a concept of one medicine, where there's been lots of cross-fertilization of research between humans and animals. And previously, this used to really be one-way traffic, where there'd be lots of experimental work done on animals. They'd receive none of the benefits, we'd get them all. These days, there's a lot more movement back and forth. So our animals are starting to get much more options that are available to us. So back to orthopedics, bones and joints. This specialty is really subdivided into 3 groups. There's routine, which are just the routine ailments, much the same as you or I. There's the sports medicine. So there's the athletic dogs, the real cool types of sports medicine injuries, much the same as you might see on a football or a basketball field. And then we've got trauma patients. And all of these patients are presenting with some degree of gait abnormality or lameness or functional inability. And overall, these guys will limp for the same sorts of reasons, or same 3 overlapping reasons as us. And if you remember back to school what a Venn diagram is, this next slide might remind you. But they limp for the same reasons. So there might be a neurological reason, so a problem between the brain and the toes. They might limp because they've got a mechanical reason, so a frozen joint or a limb or an absence of a limb. So it's not painful, it's not neurological, but there's a mechanical reason. And the third reason might be pain. Now, pain is an interesting one because I'll often have clients come to me with a dog that's limping, that the dog still wants to run around, the dog still wants to play, but it's hopping on 3 legs. And the question I often get asked is, I don't think my dog's in pain. Do you think my dog's in pain? Well, if during our exam we rule out a neurological cause and a mechanical cause, then there's probably a painful cause. And animals feel pain in the same way that you and I feel pain. So there's hot and cold pain, there's sharp, stabby pain where you and I might go, ouch. Dogs and cats will whimper. That's a pretty extreme form of pain. And then there's all the subtle, low-grade, grumbly pains where you might just put up with it. Your behavior might change. You might become more irritable. You might become less willing to do things. And then there's pain when you use your leg or when you ambulate, and that's avoidance pain. And so an animal that's limping, if there's not a neurological and mechanical reason, is often limping to avoid pain. So pain is a really key thing to think about with our animal friends. Now, the veterinary orthopod needs to work out which of those 3 causes is the cause, or which of these 3 reasons are the cause of the lameness. And this can be a bit of a detective work because our patients can't talk to us, but we rely heavily on pet owners because they can talk to us. And taking a history is really powerful as far as getting an understanding of when the lameness developed, how it developed, is this a progressive problem? And that's a really useful first step in working out what's going on with the pet, is simply talking to pet owners. The next part of the exam, the next part is the clinical exam. And the easiest thing that I can do is look at a patient. And there's more that's missed by not knowing, by not looking, pardon me, than by not looking. Pardon me, there's more that's missed by not looking than by not knowing. And clearly these 2 pictures are different. They're both Dobermans. One's a stock picture of a show dog. The other is one of my patients in outside a clinic I used to work at in the UK. Now, clearly the one on the right is looking a little bit more depressed, but when you look at the standing conformation, there's a clear difference between the 2. And so in a live audience, I'd pick on a member of the audience to say, okay, what's different about these 2 dogs? I don't have that option tonight, so we're just going to go to the next slide. Excuse the pixels on the picture on the left, but clearly you can see a difference between the hocks or the ankle joints on the patient on the left and the patient on the right. Now, this is an altered limb conformation. I know what's going on with this dog without touching this dog. This, just simply looking at this dog, tells me a lot of information. And what I'll show you with the next slide is a stylized or picture of what we're looking at. So this is a cartoon of what's going on. You've got the purple superficial digital flexor muscle that's coming off the back of the tibia, going over the point of the ankle and inserting onto the toes. And you've got the red gastroc muscle, or the calf muscle as it's known in people. So the dog on the left is the picture on the left. That's what it should look like. The dog on the right, and I'll go back to that picture, has the dropped hock and the curled over toes. And that's the picture on the right here, where you've got a failure or rupture of the Achilles tendon or the calf muscle, and that drops the hock and that stretches the superficial digital flexor tendon. So simply looking at our patients tells us a lot as far as what's going on with them. Sometimes things are a little bit more subtle. And confirmation assessment is also really important, as it gives us an idea of what sort of orthopedic problems we might be predisposed to. And again, going back to us being very much built off the same model, this is what our knees look like. And with the orthopedic training, as I'm walking down the street and I'm looking at other people's legs, I can't help but see this image in my mind. So just like people, dogs and cats, their conformation predisposes to different orthopedic problems. So we've taken a history, we've had a look at the patient. The next thing to do is to watch the patient walk. And this is also quite important, because it can be quite tricky to localize the lameness to the front, the back, the left, or the right. Now, sometimes it's really straightforward. The animal's non-weight bearing. Sometimes it's a little bit more subtle, like this patient. So this is a patient. This dog is not limping on its front legs. Its head staying nice and stable as its left and its right paw are hitting the ground. But as it turns around, if you look at the hip on the left, the hip is going up as the left paw hits the ground and going down as the right paw hits the ground. This dog has a left hind limb lameness. They're not always subtle. This poor little guy is obviously very, very lame on both its back legs, and it's obviously got a conformational abnormality. This poor little guy has a bilateral patellar luxation that's a grade 4 out of 4. So again, just looking and observing the patients, we can tell a lot as far as what's going on. The next part is the fun part, which is the physical exam. And this is also important. So going back to those 3 causes, is this a mechanical cause? Is this a neurological cause? In this little patient, I'm assessing some reflexes. So much the same as us. If you go to the doc and the doc hits over your kneecap, you're going to have that kicking reflex. But with the exam usually starts with an assessment of the normal limbs. And I'll often have clients look at me in a confused manner when we're talking about a left hind limb lameness and I'm examining the front legs. The reason I'm doing this is it gives me a baseline on how the dog reacts with an examination. So dogs, like people, have lots of different personalities, and those personalities from one extreme to the next is the dog that is very hyperreactive. So I approach the dog starts yelping. The flip side to that is the dog that stares off into space and looks at the wall, and I can do just about anything without generating any reaction. Now, most dogs are somewhere in between, but starting the examination with normal legs gives me a bit of a baseline. It's also good for picking up other problems. The next step that we do is diagnostics, and ideally the tests that we do are a test that will rule in or rule out the most obvious problems. So if we think bone and joint problems, x-rays are often a good starting point. So this is that dog with that left hind limb lameness, and on an examination, the dog appeared to have significant left hip pain. Off this x-ray, this is actually an x-ray of very nice looking hips. So the hip is a ball and socket joint. And if you look at the pelvis, you can see the balls and the sockets quite clearly. That these are normal x-rays. So unfortunately, this test didn't give us the answer. Just like us, we can have CTs performed as well. Now, CTs are great for giving that high detail 3D information, which you can't always get from x-rays. So x-rays are 2D pictures of what you can see here as a complex 3D structure. Now, this is a really cool 3D reconstructed image, but with these images, I can also get lots of fine detail cross-sectional imaging as well. In this case, again, this CT came up as negative. So I've gone to the two tests that are most likely to give me an answer for a bone or joint problem. I'm starting to lose options as far as diagnostic tools. So the next step is I did an MRI of this dog. Unfortunately, I don't have a pointer on here, but if you look at the image, there's a right and a left marker on each side of the screen. So it looks like it's on the opposite side that it should be. If you looked at that image, it's not symmetrical. There's some whiter tissue on the side that's marked left. This dog had significant tearing of the rotator cuff muscle, or the rotator muscles of its hip. So we've worked our way through the diagnostics, and just like us, we've got x-rays, CT, MRI available. So sometimes direct visualization is also useful. And so with dogs where I suspect a tear of the cranial cruciate ligament, so an ACL tear, sometimes the knees are stable, but I'm getting significant knee pain. One way to confirm the diagnosis is to do an arthroscopy. And this is a picture of a tearing cruciate ligament. And so just like us, keyhole surgery, arthroscopy, and diagnostic arthroscopy are really good options as far as working out what's going on with our patients. So once we have our diagnosis, we think about treatment. Now, not every problem is surgical. That sounds sacrilegious coming from a surgeon, but not every problem needs surgery. And so ultimately, there's three different pathways. We've got rehab, we've got medical management, and then finally, we've got the fun part, which is surgery. Now, choosing the right pathway for each patient is important because there are risks and benefits for each. Some cases will have the same outcome whether you do surgery or you do rehab. Clearly, there's risk associated with surgery. So in those patients, we're going to choose rehab. And this is a dachshund that's got a spinal problem that is having some post-op rehab. This dog actually had a spinal decompressive surgery. This rehab was, this underwater treadmill was part of how we got the dog moving again. Some pathways you don't need rehab, you don't need surgery. We can simply manage with medication. And just like you and I, you can get sprained strains of joints, simply 4 to 6 weeks of rest like you or I would do for a serious ankle sprain, and some pain relief is needed. Sometimes that's all we need to do. Ultimately, treatment is dependent on the disease, what's expected of the patient afterwards, and also the expectations versus the risk tolerance. So what are the risks associated with doing surgery or treating with medication? Hip disease is a really good example of different pathway options. Now, the severity of the changes on the x-rays don't necessarily correlate well with function. On the left-hand screen, we've got a lovely set of hips. On the right-hand screen, we've got a dog with hip osteoarthritis secondary to hip dysplasia. Now, some dogs will do great without intervention, and around 50% of dogs with ugly-looking hips, like the image on the right, will be fine. They'll run around at the park, they'll play ball, they won't need any intervention. For those that start becoming lame, that start having a functional impairment, a good number of those dogs will simply be managed well with rehab and pain relief. Exercise management, weight control, again, much the same as we'd manage ourselves. Now, in cases where non-surgical management is not giving us good enough function or a comfortable enough patient, we think about surgery. And now, if this were you or I, we'd have a hip replacement. And this is what this dog got. Now, the dog's got disease in both sides. Does that necessarily mean that the dog will need a hip replacement in both sides? Absolutely not. So about 30% of dogs with bilateral disease, which means disease or hip osteoarthritis in both sides, need both hips done. That means 70% don't, which are pretty good odds. If the dog needs it, it's still a very good option. And so this dog ended up having both its hips done. And overall, we'd expect an excellent outcome in over 90% of patients after a hip replacement. Now, a hip replacement isn't a benign thing. There's risks of complications like infection, fractures, dislocations, those sorts of things. So when we're talking about hip replacements, we're doing a risk-benefit analysis. Are we getting good enough function? Or one, are the hips the cause of the problem? Two, if they are the problem, can we get good enough or satisfactory comfort with non-surgical options, weight control, pain management, those sorts of things? And if not, does the function warrant the potential risk of a significant complication? Now, the complication risks are low. This is a surgery that's been around for 3 to 4 decades, but there's still a risk. So for most dogs, for each individual dog, it's a different story. And so when deciding on a treatment plan, it's very much down to the individual dog. Hip replacements are a really good example, actually, of us being very similar to people. So some of the earliest hips were done by a surgeon called Charnley in the UK, and the initial trial patients were in dogs. So dogs got the initial hip replacements in the UK before it moved over into people. That was in the 1960s. Hip replacements in people and in dogs have come a long way since then. The picture on the left is a dog. The picture in the middle is a person. The picture on the right is a cat. All of these implants look very much the same, and that's because they're all built from the same model. So going back to the other group of patients that we see are trauma patients, and these are animals with broken bones. They have lots of traumatic injuries. They're often hit by a car, or they've sustained a significant concussive trauma. They've fallen from height. And often these patients will have sustained head, chest, abdominal injuries, all of which can be life-threatening. So I'm not the first person these guys see. These guys will usually come through an emergency service where the emergency docs will deal with the life-threatening problems. Broken bones are something that are more often dealt with later, and that's where I get involved. So this is a cat with a femur or a thigh bone fracture. It's a relatively straightforward fracture in that it's 2 pieces, it's transverse, it's not in multiple pieces. I'll often get asked, why can't we just put a cast on it? For that patient, casting isn't a good option simply because to stabilize a bone with a cast, you need to stabilize the joints above and below the fracture. So with thigh bone fractures, you can't do this because the patients won't tolerate casts that go around their pelvis. So for most thigh bone fractures, casting is not an option. To be fair, casting is not a good option for most pets, and that's because it doesn't provide very strong fixation. So it doesn't provide a great deal of stability to the bones. And that's a problem for the veterinary patient because dogs and cats are expected to use their legs immediately or try to use their legs immediately. So for you or I, we can, our doctor will say, now, here's some crutches or here's a sling. Don't use your arm or your leg for however many weeks. You can talk to a dog or a cat till you're blue in the face and they'll do what they please. So with our patients being non-compliant, it's a big issue. And I really like this picture. This was from a practice I worked at in the UK. The guy on the left in the pink scrubs was the head nurse. He was extremely good with cats. I'd asked him to get one of my patients out to examine it post-operatively. This was the result. So you can, if you look carefully through the window in that door, you can see a cat hiding on top of the cages. If a highly experienced, very, very good vet nurse can lose an animal like that in a controlled environment, we know what can happen at home. So casting for an animal that's potentially going to be as non-compliant as this is generally not very successful. But that's a pretty impressive picture. So for most fractures that I see, they'll end up with internal fixation. Now, internal fixation means that we're rigidly stabilizing the fracture, often with plates and screws, sometimes with pins as well. Incidentally, these implants are all made by the same companies that make plates and screws for us. In fact, these screws and plates are often designed for us and that have entered the veterinary market just simply because they're the plates and screws we have access to. More modern times, these same companies are now making plates that are specific for anatomical locations in animals and for specific types of surgery. Not all fractures are straightforward, and some of these take a little bit of creativity to reconstruct. And more often, these sorts of messes are from animals that have been hit by a car. This is a cat that suffered a shattered pelvis and a broken thigh bone. Looks like a mess, but this is the repair. And again, these are the same sorts of implants that you or I would have. So whilst we tend to think of all the differences between us and our pets, we're actually not that different. And as such, the medicine and surgery options available to us aren't that different as well. Thank you very much for listening to the talk. I'm happy to take any questions.
Thank you very much, Dr. Kalff. That was lovely. I loved the species comparison for sure. That is very eye-opening. So I should have done the housekeeping at the beginning that there is a Q&A at the bottom of your screen, as well as a chat. And so if you have questions, if you want to type them into the Q&A, then you've got a brilliant person here to answer them.
Oh, that would be you, Dr. Birch, not me.
Yeah, not for orthopedics. So and also Jake's putting up our QR code for anyone who is interested in finding out more about BirchBark or making a donation. As he mentioned, it's got 3 pillars of focus. That's avoiding economic euthanasia and helping people get their pets healthy when they don't have the financial resources to do so. Grief support for people in grief around losing a pet. And then education webinars. And my goal here is the better advocate we can be, the more we learn about watching the hip swing up on our dog when they're walking away from us and how that signifies a lameness, that kind of thing can make us better advocates for our pet and recognize when they're having compromise or shift in their quality of life. So we have our first question, which is there anything we should do to help prevent arthritis in cats and dogs?
Weight control. So it's a great question. And ultimately it comes to weight control. So weight control and exercise. So the best thing that we can do for our patients is actually the best thing that we can do for ourselves, which is exercise. There's been a number of studies looking at people and longevity in people and happiness in people. And pet owners tend to be happier people that live longer, particularly one example is with dog owners. Dog owners routinely take their dog for a walk. They're more likely to be active. They're more likely to get out and about. It's the same for for our dogs and cats. If dogs and cats do get arthritis, which it can happen, we know that dogs and cats that are overweight suffer pain more than dogs and cats that are not overweight. And there's been a couple of really good studies in people that have been mirrored in dogs and cats showing reduced pain scores for the same level of osteoarthritis. And they're very well controlled studies. So best thing to do to minimize the effects of osteoarthritis and to reduce the chance of it developing is good exercise and weight control.
That's great, because this next, not really question, but thank you to you. Rebecca Bard says, Dr. Kalff treated our dog Newt for elbow dysplasia, and we went the weight control and meds route, and he's doing great. So thank you.
Perfect.
Yeah. And one of our receptionists years ago adopted a Labrador that was about 105 pounds. And the radiographs of the hips were so bad, everyone went, oh, it's going to be a quality of life thing. She got that dog to 65 pounds, and it was a new dog. So, I mean, it was morbidly obese, but it was nice to see that in its mobility and its shift as well. And then there's a question that came in on the chat. The question is whether braces are at all effective for conservative management of orthopedic injuries. I know some people who've spent a fortune on custom braces for CCL ruptures, but I've heard very mixed reviews.
Depends on again, this goes back to it depends on the disease and the expectations. So there are some good instances and uses for braces. So Achilles tendon ruptures in dogs that are not suitable for surgery can be very, very good. They mechanically stabilize the ankle to a fixed angle. And so braces in that situation are very good. Braces as far as cruciate disease, I'm not a fan of. If surgery is not an option, then the money is better spent, or the resources is better spent with a good rehab physiotherapist. And that would involve exercises, strengthening, hydrotherapy, those sorts of things. The difficulty with some of the off-the-shelf braces are they're not custom fit. And if they're not custom fit, you're more likely to have rub sores and pressure sores from them. And mostly our patients often can't tell us when they're developing a rub sore until the sore is developed. And sometimes those sores become worse than the initial problem they were meant to treat. If we are going to use a brace, a custom brace that's built for the dog, usually that involves taking a cast of the dog's leg, and then having a company like OrthoPets or Hero build the brace bespoke to that cast, or custom to that cast. That minimizes the risk of pressure sores developing and rub sores and those sorts of things, and maximizes the chance of the dog tolerating it. The cruciate braces, the difficulty with them is these knees become a mechanically unstable knee. It's a multi-directional instability, and the functional outcomes are there's very little difference between them and a dog that's had good physio and rehab. Surgery for cruciate disease in most dogs will provide the superior outcome for most dogs, and there's lots of studies that have shown that. But for patients where surgery is not an option for whatever reason, I tell my clients to go spend the resources with a physiotherapist and hydrotherapy. They're going to get much the same much the same outcome, if not better and more predictably than a brace. Going back to custom versus off-the-shelf braces, the difference between you or I, my knee is very much the same as most knees out there. A pug's knee or a Cocker Spaniel's knee is very different to a Whippet's knee or a Boxer's knee or a Shepherd's knee or a Great Dane's knee. So with dogs with a significant variation in size and shape, there's no real off-the-shelf braces that are going to really be safe, if that makes sense.
Thank you. That was a great answer.
It's a really good question. I get that question a lot in consults. Can we use a brace? So it's a great question.
Yeah. And there's another question. How about supplements to help with mobility? Can you give your opinion on things like Dasaquin, Cosequin, and whether they're helpful at all?
I'm going to say something that might get me in a bit of trouble, but look, I'm very much evidence-based, and the evidence for most of the supplements is at best thin, which means a lot of the supplements, there's no significant difference between it and placebo. The difficulty with that is the placebo effect for supplements is around 60% in people. And that means you could give a sugar tablet or a supplement tablet, you give a sugar tablet to someone and say it's going to help with their joint pain, and 60% of people will report some degree of improvement. So the bar's pretty high to get over that placebo, or to demonstrate that you're significantly better than a placebo. Of all of the supplements, glucosamine, chondroitin, omega-3 fatty acids, all of those groups, the only supplement that has any significantly good evidence are the omega-3 fatty acids. The glucosamine, chondroitin, the evidence is pretty thin. There are some studies that are very positive. There are some studies that show no difference at all. When you look at a meta-analysis, which means a study that's looked at all the previous studies and combined the evidence and rated the evidence in quality, the meta-analyses of things like glucosamine, chondroitin there's no difference with it in placebo. It's a good question. I often get asked that in consults as well. I tell my clients omega-3 fatty acids are the only supplement that has any good quality evidence behind them.
Great, thank you. Okay, and then we have a next question. Since you mentioned physiotherapists, I know there's a lot of canine physiotherapists in the UK and Germany. Do we have someone similar available here in Santa Cruz County?
Not in Santa Cruz County. It's a good question, and it's something that I was pretty spoiled with in Australia and the UK. There are options in the Bay Area. So the SAMS clinic have a sports medicine rehab specialist. This is a fairly new specialty that's kind of an offshoot from orthopedics and the surgical specialties, but they concentrate on rehab and sports medicine injuries. They're not surgeons, they don't operate, but they're very well versed in all the non-surgical treatments. There's one of them that's based in the SAMS clinic in Mill Valley. There's two physios who I think it's just one at the moment at Sage. The physios over in the US tend to be physios that started their professional lives in sports medicine and rehab for people. they've then done further training and become physiotherapists for animals. They had one relatively recently at Sage. They were very good. Sometimes there's a bit of a rotating cast of them, so I don't know if they're there at the moment, but they were very good. Underneath that tier, so that's the top tier of the sports medicine and rehab specialists and the physios that did their training as sports medicine physios for people. The next tier are the vets and technicians that have done rehab training, and there's a University of Tennessee rehab course. It's a pretty good course. The technicians and vets that have done that course tend to be pretty good. There's a couple of tiers in that rehab training. The availability of that, I think Sullenberg has done some form of that training at Coast, and she runs a pretty decent rehab service there. It's the tier below the physio and the sports medicine and rehab specialists, but it's an option that's in Scotts Valley. I've been told recently Becky Lewis has retired from Harden Ranch at the Banfield Harden Ranch Clinic in around Salinas. She was very good. She was within that tier. After that, we get to the so-called chiropractors, and the difficulty with those people is, whilst they might have some good results, is there's no formalized training, and it's hard to quantify and qualify their work.
Yeah, that's unfortunate. It would be lovely if we had more support like that.
And it's a real hole in the profession at the moment, particularly from an orthopedic surgeon's point of view, because going back to the talk, there's not every patient needs surgery, nor should have surgery. And for those patients, when I was in the UK and Australia, having a physio team available, I realize how much I took them for granted now.
Yeah. Yeah. Well, thank you very much. It looks like our questions have stopped. So yeah. No new ones. And certainly Dr. Kalff's at Pacific Santa Cruz Veterinary Specialists, and definitely really value his input on my patients, my internal medicine patients that get lame. They get headed in his direction. So thank you for all you do in the community, and thank you for sharing your knowledge and that great presentation with us tonight.
No worries. Thank you.
Yeah. And we're getting some thank yous coming in on the Q&A, and they appreciate the information you've shared. So
no worries.
Right. We'll keep up the good work, and thank you everyone for attending. And if you reach out to us if you want to know any more about BirchBark, and keep taking care of those pets. All right.